Hello, my name is Rolf Craven. I teach pharmacology to graduate, undergraduate, medical, and dental students. That's the study of drugs. This video is not for students. This is a different audience. This is designed for lay people who may be taking some of the drugs that I'll be describing, or for people who are taking care of them. What I want to do is describe in everyday language how a few important drugs work and what their side effects are. In the modern healthcare environment, visits with the doctor may be quite brief and they may be complicated. They may be explaining a lot of different things, and some of the information they give may be hard to follow. If you look on the web, you can see a lot of different information, some of it quite confusing, and some may even be used to try to sell products. This video is not intended to alter your prescription or your diagnosis. It takes a long time to learn how to diagnose and treat cancer. This is only intended to inform you about drugs that you may be taking. Let's start with a drug class that's used for treating cancer. Many of these drugs are basically poisons, and that's how they get their harsh side effects. The reason that they work is that they are killing cells that are growing. In an adult, most of your cells are not growing. So for instance, in your hand, muscle cells used to contract your hand are doing their job, and they're growing at a very slow rate. The nerves that sense feeling are not growing. So those cells are not so much targeted by chemotherapy, whereas a growing cell is. For a cancer cell to divide, it has to take its DNA and then make a copy of it, and then separate that into progeny cells. Most cancer patients are treated with drugs that block that process, DNA replication and separation, in combination with radiation and also in combination with surgery. Now you might think, well, why do you need any of these drugs? Because the surgeon is already cutting out the tumor. The answer is that a tumor is not like a little ball. Some of them are, and if they are, that's a good thing. More likely, they tend to spread, and they can even disseminate into the tissue around the tumor. So when you remove the original tumor, you can leave some cells behind, and that's what the chemotherapy is attacking. One of the most popular and widely used classes of drugs are alkylating agents, and so these were originally identified in warfare. In World War I, armies were fighting and ground to a halt along huge battlefields. They dug themselves into trenches, and one side got the idea to float poison gas across the battlefield, which would sink into the trench on the other side and kill the soldiers in it. And at first it worked very well. The soldiers had these initial attacks where they would breathe in the gas to horrifying consequences. Some of the soldiers would survive that initial attack, but then they went on to get sick later. And that was because of the dividing cells in their body being targeted by the chemicals in the poison gas. And that is how the chemotherapy works. Now you might think, well, I'm not going to go to the clinic and get a poison gas attack, and that's not how the drug is given anymore. It's given IV, so it's going to go through the bloodstream, spread throughout the body, and target the tumor in addition to anywhere else in the body that's exposed to the alkylating agent. And that's where the problems come. The drugs that are used in this class, one of those typical is cyclophosphamide. It's very closely related to some of the gases used in warfare. It's again given IV and spreads throughout the body. Other drugs like busulfan are primarily used for treating leukemias, but there are many, many alkylating agents that are used for cancer treatment. And so all of this sounds great. You cut out the tumor, you irradiate, and then you give this chemotherapy. So why are there such harsh side effects? And the reason is that your immune system is constantly regenerating, so you're generating a lot of new white blood cells, a lot of new red blood cells that allow you to transport oxygen. When you kill those kinds of cells, then that causes weakness, and it makes you very sensitive to infection. There is another, well, you can also get problems in the GI tract because your guts are constantly turning over, and you can get problems with the skin and hair follicles. Many of the kinds of side effects that you think of when you see a patient taking chemotherapy. There's another class of problems that's also quite familiar to cancer patients, unfortunately, and that is that chemotherapy triggers nausea and vomiting. Our bodies are very good at sensing poisons in the environment and trying to expel them. And so they sense the chemotherapy and our bodies do the best they can to expel it. And so that can be very uncomfortable and can cause limits to how much treatment a person can handle. Cancer is a very difficult topic. I hope that by learning something about how these drugs work, it's helpful. Perhaps it can trigger some questions that you need to address with your doctor next time you see them about maybe some other drugs you've been taking or the environment you're in, like if you're around a lot of infectious agents or sick people. Sometimes I think that if you know how something works, it also might make you feel more optimistic about the treatment that you're taking, because these are drugs that do help and extend survival of patients. I'll be posting more videos about cancer drugs in the near future, and again, I hope this is helpful.